Welcome to the Krista Escamilla Show.
Hello, everyone. Welcome to this week's episode of the Krista Escamilla Show. Thank you so much for being here and sharing time. I hope your new year is rocking and rolling and you're having fun wherever you're at and doing all the things, listening and learning and growing, the three things we love to do here at the Krista Escamilla Show. We have an amazing guest today, but before I introduce you to him, I do want to thank our sponsors. We're so grateful for each and every sponsor we have. Because of them, we get to share and learn from amazing experts here in West Texas. So without any further ado, a special thank you to Rig ID Workwear, to Omni Midland Hotel, also to the new Laughlin Hotel, which will be breaking ground this year. Also, thank you to Kevin Foreman of Foreman Financial, and to Midland Cap Company and joincapclub.com. Support those local businesses however you can, or just support local and follow them on social media. They would appreciate your support. Thinking of support, someone who has supported us here for years in the health and medical area is an amazing doctor. I cannot wait to introduce him and share all his titles. We will first start with Dr. Timothy Benton. He is the Regional Dean and Professor of Texas Tech University Health Science Center School of Medicine in the Permian Basin. Did I get it correct?
No, that's correct.
Hey,
that's
a mouthful.
Quite a mouthful.
And I'm sure you have many, many other titles, but we are so appreciative. Thank you for being with us today.
Sure. Thank you for having me. That's a nice introduction.
Well, I know you're also a physician, and we are going to talk all things medical today. And most importantly, we're going to get to know you better, because I have heard so many wonderful things about you through the years from our guests that have been here in the same spot that you're sitting in, including Dr. Stephanie Caples recently. So first of all, let's start with, how did you get to West Texas?
How did I get to West Texas?
Yes.
Really, medical school brought me here.
Okay.
All right. So I grew up in Dallas, inner city Dallas, on the concrete and the pavement, but always wanted off of it. And I'm the son of a minister, so I watched my dad serve people, and then was influenced by my pediatrician, wanted to go to medical school, but I wanted the connection with people. I was interested in rural primary care.
Is that unusual? Like, do most people, when they're in med school, think, I want big city, or is that something you didn't see much when you were doing?
Yeah, I think so. Not too popular to want to go to primary care. And I knew I wanted to do that actually since I was 9 years old.
Wow.
And so I picked Texas Tech. That was in 1990.
Pretty rural.
Pretty rural back then, right? It was one building on campus. Across the street was Cotton Field.
Wow.
So my goal was to be a practitioner, general practitioner. We call it family medicine as a specialty, and in rural communities, and build community and work with people.
What was it about family medicine that brought you in?
That's an interesting question. So actually, I said my pediatrician was my influence, and I thought initially it was pediatrics, but then I learned of the specialty of family medicine, which is primary care of the whole family.
Okay.
So in my private practice era, which was the first third of my career, I saw patients literally from birth to death.
Wow.
So I did not actually deliver babies, although I trained to deliver babies, but I would catch them from the obstetrician as neonates and take care of them all the way to being a hospice medical director.
Wow.
On the other end.
I bet that was, looking back at, and when you're choosing and selecting, you could go, okay, I'm going to serve this patient at one point in their life, but you get to serve them at all phases of their life. That's very unusual. Right.
And in my practice, what I loved is I would go into a room and see a 2-year-old, and I would go in the next room and see an 80-year-old.
Oh, I love that.
And sometimes I would see them together, right, where I would see mom and child and grandmom, all together. So
I love that. So that's definitely a high of what you do. What's the challenge of what you do?
It's the people and the connection, right, is what I was after, and that's the heart. The challenge, though, is exactly the same.
That's what I would think.
Where there's a lot of diversity from a 2-year-old to an 80-year-old, and a lot of different things to take care of. So you have to really polish your diagnostic skills.
I bet.
And have a broad diversity of reading and learning. So,
right.
challenging that way.
You must be pretty smart. I'm guessing here. You're a pretty smart guy.
I don't know that.
To be able to cover from pediatrics to geriatrics.
So how do you go from a rural family physician to a professor at medical
yes.
school?
How do you do that? And how did you get from Lubbock to Midland, Odessa?
So medical school, the way Texas Tech works is we have regional campuses.
Okay.
Okay. So the medical school class in their third and fourth year splits up. Mm-hmm. Because they take 180, you can't all learn the clinical years, which is what's the third and fourth year in Lubbock. So some go to Amarillo. Back then, El Paso was the regional campus. Now it's Odessa, and we'll talk about that a bit. I was assigned to the Amarillo campus and married West Texas.
Okay, so you got here the way a lot of us get here.
That's right, but I love it.
I love that.
Those were the people I wanted anyway. And in April, we'll celebrate 31 years.
Oh, congratulations.
Well,
that is
thank you.
amazing.
Thank
And I love that you made West Texas your home because
Yeah.
we just celebrated 25 years, and it is truly a place where I can't imagine raising our family any other place in the world.
Yeah, it's probably unusual to hear, but we love it here.
I know.
It's-
Well, I'm
it's
with
the
you.
people.
I'm in Team Love
Yeah.
West Texas. Well, I'm so glad that you've chosen West Texas
Yeah.
to do what you do. And like I said, I've heard so many accolades from you and your colleagues and your peers. Tell me what the past 31 years here in West Texas has probably changed a lot, I'm assuming.
It has a bit.
Tell us a
right?
little bit about the
So,
changes in not only medical, but what you've experienced with
Mm.
your patients.
I don't know if I want to reveal all of the things I've seen change in medicine because it's the things you see now were very different back then, or we
bet.
didn't have them, right? So some of these new medicines and designer drugs and things didn't exist. So we practiced medicine a lot different 30 years ago.
Mm-hmm.
That was much more, much less test-based
Okay.
or X-ray or scan-based.
Mm-hmm.
And it was people connection based.
Okay.
So
So more listening and connecting rather
Right.
than let's look and see what. So technology has changed it a lot.
Absolutely. Our diagnostic tools were speech and our hands,
Yeah.
right? And our ears, our senses.
And your
So-
brains, because then you had to figure it out. You couldn't
Well,
Google it,
sure.
which
We
nobody
had to
should
use all-
ever Google any medical advice. Just throwing it out there, trying to help you out. That is not where you want to get your medical advice.
I'm actually okay with it. Bring your conversation, but let's have the conversation.
Okay, I love it.
But,
I love it.
but don't just take whatever Google says.
That's right,
So-
because you read Google and you can
It'll
go.
scare you.
Yeah, it'll scare you. You think, oh my gosh, I have all those, but do you really? Let's really talk about where you're at in all this, which is why you have a doctor like Dr. Benton. So things have changed a lot.
Things have changed a lot. And my progression was 10 years of private practice, and then I joined the medical school as faculty and worked my way through that system for the last 20 years.
Okay.
I was general faculty, kind of doing some research and teaching kinds of things, right? And pretty soon my bosses said, well, you should be administrative. And so I then became a residency director.
Okay.
We did a nice job of that in Amarillo, so this was in Amarillo. I'm trying to get to the point of how did I get here?
Right.
I
You're
think
doing a
there's
great job.
question
We're
you're
getting
asking
there.
me,
We're
right?
getting yes.
And so after 8 or 10 years of that in Amarillo, then my dean asked me to come to Odessa to be the chairman of the Department of Family Medicine here.
Okay.
And
So you still were
and
practicing.
to rebuild it. Yes, and I practiced too. So that was what was appealing to me in academic medicine. Literally in Amarillo, I moved across the parking lot from one building to another, from private practice to academic practice, and my patients went with me.
Oh,
So I
that's
continued to
fantastic.
practice, right? And even when I moved here, some of the patients would drive to Midland, Odessa too.
From Amarillo?
From Plainview, in
Okay.
between. My original practice was in Plainview.
Again, a testament that you must be a pretty good doctor
No,
if they're
no,
going to drive
no.
3 hours to see you or 2 hours.
Anyway, and that was now 12 years ago.
Okay. So you-
Moved to Midland.
And then at some point you switched to, you said you're a professor, so you are in the professor role.
Right.
Yes. How was that, transitioning from seeing patients every day to now teaching what to look for when you see patients?
So the way we work in medical school, the first 2 years is book work,
Okay.
right? And the second 2 years is clinic work. So it's bedside teaching. Most all of my work in the medical school has been at the bedside.
Okay.
So I've really been practicing.
Right.
Now where I am as a dean, it's too heavy administrative, sort of running the entire operation, that I don't get to practice currently.
Okay. I know you have some pretty big, I guess we'll call them significant titles. Second largest facility. Tell me a little bit about you were kind of talking about that off camera.
So what we did when I moved here, I was asked to come here to to build the family medicine department and to build the residency, because we'd done a really nice job in Amarillo building the residency. And my then boss, the dean of the medical school in Lubbock, told me, he said, if you'll get involved in the community, you'll be just fine. Well, I'm a little bit odd. You may figure this out in this interview.
You are not odd.
And
by the way, happy birthday to Dr. Benton. He was like, how did you find out? It is his birthday today. That is fantastic. We won't ask your age unless you want to reveal.
That's okay.
Okay.
I don't care. But it starts with a 5 and ends with an 8.
There you go. There you go. Well, happy birthday.
Thank you.
So they said, get involved in the community.
Yeah, and I took that literal. So what I did is engage my residents and my faculty in various community opportunities where we could create win-win opportunities that would be service to people that they touch in patient and delivering medical care. But then I also created curriculum around it to make it educational.
Nice.
So we wound up just connecting repeatedly over many years throughout Odessa, expanded into Midland. We initially were based primarily in Odessa, but then we started reaching out to rural communities, and over time, what I then had was 16 residents has now grown to 69. So
wow.
we train 23 per year.
That's amazing.
And with that, then we had to grow the faculty, because the accreditation requires us to have certain ratios. And so we've gone from 5 faculty to 16 faculty.
And that's a big jump.
A big jump.
So you had to hire a lot more people, like you said, the faculty.
Right.
But most importantly, for anyone that has been here in West Texas so long, the hardest thing 20 years ago was to find doctors to come here, stay here. Now you're training them here with the goal of
keeping them and retaining them. And that's exactly how I built this, actually. I trained most of those the people that are now faculty. They were my residents, and then I kept them.
I love that.
And so that's how we grew it. But anyway, the second largest, so 69 residents, or 23 per year. It's a 3-year program. That's the second largest family medicine residency training in the U.S.
Wow. Congratulations.
Right
Right here
Right
in West
here.
Texas. I think that's amazing.
Amazing.
So needed, too.
But that tells us what really good assets we have here.
Absolutely.
And in the people.
Absolutely.
So I think that's a real key to community building. Let's don't look at our community as what we don't have, but let's look at the people we do have.
I love that.
And the work you're doing.
I love that. Well, there are so many amazing people here in West Texas, and we want to keep them here. I mean, that truly is, because we're just stronger, right? We always say it. I know it sounds cliche, but we're better together. We are all better together if we can keep the good talent that you are training here. Just our health care will be better. What is the number one thing that you want people to know about healthcare in West Texas? Like, if there's one thing you thought, you know what? I either want this myth to go away, or I want them to know about this.
I'm going to circle back to community. Again, I don't want to make it cliche, as you say, right? But I think health really ultimately comes at home and in community. So there's a lot of interesting stats out there to look across our region and look at various county health rankings and things that aren't always consistent by what we would traditionally think by education or access to care, although access to care is critical and something we need to grow here. But you can find some communities out here that are very healthy, but don't have those things. So somehow we need to work together on the social aspects of healthcare as well as the science.
Okay,
right?
let's do it
And
today. How can we teach today? What can we teach today?
What can we teach today? Health outcomes are about 20% related to seeing me in the office, but that means the other 80% is related to other things like mental health and social determinants, right? So it's things that you do in your life on a day-to-day basis to take care of yourself. And I would like to figure out how we can influence those people at home.
Let's do it today. I'm a huge advocate of and I am not a doctor. Let me preface this. My kids will call me Dr. Krista No MD because I think I'm a doctor, but I have no MD. But I think there's a direct correlation between mental health and physical health. And if you get those endorphins going first thing in the morning and get up and go for a walk and exercise and drink your water. But that is my non-professional view. I want your professional view.
So,
what would you like to see? Daily habits, because I believe in the power of daily habits. What daily habits would you like to see people do for their health that will help you when they come see you for that 20%?
I think the best thing that I could do with that is hire you and give you an honorary doctorate so you can tell everybody.
Let's do it. Let's do it. I'll preach it every day. I always joke that if I was running for president and I would not win, let me just say, because my platform would be drink more water. Like, I feel like the world is dehydrated. Drink more water. So thank you. I'll take an honorary.
All right.
Yes, doctorate.
We'll make that arrangement.
If you were listening, you did not see the eye roll. We're on Apple and Google Play. They could have been listening.
Okay.
He just eye rolled. I'm not getting an honorary
I have
doctorate.
to be careful, my president or my dean may,
But you're the dean. You could make this happen.
Okay.
I'm just saying. So what do you want them to do in their daily habits?
I think that's exactly it. Kind of those rituals that you talked about. It's important to be active and move, right? It's important to eat right. It's important to avoid those habits that maybe we all like to have a drink once in a while or something, but not in excess, right?
In moderation.
All things in moderation.
I
Just
love that.
be conscious and aware in day-to-day activity.
What does your daily routine look like in the morning?
Oh, my daily routine.
We're going to see if he's actually doing what he says to
practice
do.
what you preach.
Yes. Do you practice what you preach?
And being a preacher's kid, I have to be careful with this. So. My daily routine is 5 a.m., the alarm goes off, coffee with my wife of 31 years.
Love that.
And visit with her. And then it is addressing spiritual need. So I do a daily devotion. I'm a little bit obsessive compulsive. I'm actually doing 3 right now.
Oh my goodness. I'm just trying to do 1. You're doing 3 goals right here.
And then I walk.
Okay.
So we still live rural in our lives. Married a farm and ranch family and have horses at the house and have a little bit of acreage, so I get out and walk and stimulate that activity, the physical activity, right? And then it's off to work.
Off to work.
And rituals through the day and those schedules too, which actually include, I use Noom. I don't know if you're familiar with the Noom app.
Yes.
So I track my calorie intake through that, and then I track my steps through the day. So I try to get up from behind the desk periodically and move.
Good for you.
So,
See, you are practicing what you preach, and you're part of the part of the 5 a.m. club, which is great.
Part of the 5 a.m. club.
Because a lot of people say, "Well, I just don't have time because I have to be at work at 8." But you can make it happen. You just have to adjust the schedule a little bit. How many steps per day?
Just have to make sure you go to bed on time too.
True.
Right?
Good point. Good point. So you getting your 10,000 a day?
That's part of the ritual. I do.
Awesome. Al just walked back in. Sweetie, I don't know if you heard, I'm getting an honorary doctorate. I said Dr. Krista, no MD is what you guys call me.
She's also a lawyer.
I can be a lawyer too from time to time.
So
Thank
you're going
you,
to be
Google.
really hard to live with.
Yeah,
After
exactly.
this.
No, because it's all in fun. I do not live by any of this or make my kids live by it either. Well, I love, I love this conversation where it's going. We want to take a quick break to do what we call quote of the day. I'm a big quote person.
Okay.
That's part of that daily habit. Is
Absolutely.
is really being an inspiration. So I want to see which one you get to pull one out of the magic bowl here, Dr. Benton. And I'm sitting here today with Dr. Timothy Benton of Texas Tech University Health Science Center, and he is picking which card did you get? First, you got
Caring.
the caring card, which
Oh,
how
perfect.
appropriate for a doctor. And what does the back say?
The back says, too many of us are not living our dreams because we are living our fears. Les Brown.
It's a good quote. What does that mean
That
to you?
is a good quote. I have a lot of dreams. Sometimes I dream too big.
Never. You
But
can never dream too
never
big,
dream
Dr.
too
Benton.
big.
It's right there.
I would love to see us fill that gap out here in healthcare needs by growing our own doctors.
Yes.
I think we have a great lot of people. And even at the high school level, right? And that's where
Right.
it starts, or maybe even junior high.
Right.
And we are actively trying to engage those people to move them to science-related careers. STEM
STEM.
is the big thing, right?
Yes.
Of course, I want to push them to medicine. But don't tell my bosses, but I'm here to advocate for medicine.
I love that.
And so we're working at that level, but also then working and partnering with, say, like UTPB in their health sciences and their pre-med programs, that we would love to take them to Texas Tech. And we have options at Texas Tech. We have a fast track program.
What does that entail? Fast track? Is
fast
that 8
track.
years, 10 years? What does it look like?
Yeah, so medical school, college is 4 years, right, after high school, and then medical school is traditionally 4 years. And then residency, the least is 3 years.
Okay.
So if you do primary care specialties, internal medicine, family medicine, it's 3 years. So
You're
it's
looking at
a-
11 years.
11
to get
years
out
from
with
high
the doctorate.
school, right.
Okay.
But we have a fast track in medical school, the family medicine accelerated track, where you can do medical school in 3 years.
Okay.
So cut 1 year off there, which cuts the expense. Medical school's a little bit expensive.
That's what I've heard. Yes.
But the great thing is it's rewarding on the other side. So
Yes.
even without the money, the people connections too.
Absolutely.
And I think there's possibilities. I see it happening. And when I talk to like Dr. Woodley at UTPB, where you can acquire a bachelor's in 3 years, right? So you can get some credit through MISD or ECISD, go through UTPB, and we actually have just, through Texas Tech School of Medicine, have an early acceptance program contract that we've done with UTPB. So in theory, we're maybe building to a 6-year MD track after high school.
And that's what you would love to see.
And I would love to see that. That would be a dream, because I think there's opportunity to make that affordable for our people, and the likelihood of retaining people here is growing them here.
I love
So,
that. Well, that is great. I am going to be cheering for that dream for you, because
Thank
I love to see anyone pursue their dream and for it to come true. And if we can make it come true a little bit faster so they can get in the workforce and help more people faster, that is a
Absolutely.
benefit, 100%.
Absolutely.
Do you have a favorite quote you live by?
Oh, goodness. I wasn't expecting that.
Good. I like the element of surprise.
We talked earlier, and I see here in your books, you're a Maxwell fan.
Yes.
I like a lot of Maxwell things, and I would say that everything rises and falls on leadership.
That's a good one.
So
How has that served you in your leadership through the years?
I guess another part of Maxwell is that stems a lot from building relationships and connecting with people, and so that's what I try to do, is build those relationships. And so that's what I think about in leadership. How can we get to servant leadership?
I love that. Well, and I think it is definitely serving you well because one of our recent guests here, I always like to ask about mentors, and she actually said you were a big mentor of hers, Dr. Stephanie Capel. So you are definitely leading well and taking John Maxwell's his words to heart. So let's
That's
talk
quite
about.
an honor from her. So,
She's amazing, isn't she?
She is amazing.
Love her time together. You'll have to listen to her podcast.
Okay.
It was fun,
All
especially
right.
since you're shouted out. Who's been a big mentor for you? Where have you, had people in your life, and how did they make a difference?
I think starting out was my dad, was my father. So as a minister, I watched him serve others. I mean, he was a great preacher too, right, and knowledge. But I saw him called out at night. I saw him go on weekends. I saw him take care of people, ministering to people. But that also became what our family life was like, right? So where we lived in community with these people too.
Right.
So that's where all of this started. My past dean was Dr. Stephen Burke, and he was the gentleman that really. He was actually regional dean in Amarillo 20 years ago when I hired on. So he hired me, and then he became the dean in Lubbock for the whole school, and we kept this 20-year relationship. He was the one that asked me to come to the Permian Basin, and one of the things about him was that spirit of relationship building and kind-heartedness, but a very brilliant person. So he was able to take all of this knowledge but remain a common person too. But one of the things that I cherish over the 20 years is I became a residency director and a chair overseeing residencies as well. I used to call him or tell him that I was his rehab department. So we used to work together a lot on students that struggled, or maybe they went off to other areas and lost their residency position, and I would bring them back. He would always call me and say, "Will you take this one?"
Yes.
And so seeing that as an example of enriching the lives of other people.
I love that. Did any of your mentors give you a piece of advice that has stuck with you to this day that you always kind of go to? Like, I call them they're the giants in our lives where, they've given you little nuggets through the years.
Well, that's another hard question. You're really digging.
I got the good ones today.
I guess the one that first pops into my mind is Dr. Burke saying to me, "If you go get involved in the community, you'll be fine." So I've used that a lot the last 12 years here.
Well, it has served you well because you have connected with some pretty big names that you've thrown out today and have some really big goals for our area. One of those has been the Behavioral Health Science Center, or Behavioral Health Center. Tell me what your vision is for that, how you see that serving our needs here in West Texas as soon as it is open. Well, I know it's already there's already things happening.
And they're still going up out there, right?
Yes.
It's quite large. It's a big
It is.
footprint out there.
It is. It's a great facility right behind the Wagner Noel. If you're flying in for the first time, you can't miss it.
Right. I said earlier I live a little bit rural. I just live north of there up 1788.
Okay.
So I drive by there every day and get to watch what they're doing.
Nice.
So, like we talked earlier, mental health is a key aspect to physical health.
Absolutely.
Right? So I think this is a tremendous thing and need in our region. Right. So there are a lot of people that need this help and this service, right? But we can't yet provide it. So I'm really appreciative of those visionaries that put this together. I would say over the years, Russell Myers has been one of those that I've looked to for guidance in healthcare leadership. And then Dr. Capels, who is working with that too. She and I, actually, she probably wouldn't want me to tell you this, and I know you'll edit this out, right?
No, go ahead and tell us. She won't mind. I love her. She's great. She won't mind anything you say.
She is amazing, right? So she was a psychologist in my department of family medicine, right? So we worked very closely together, and she's had this incredible idea of creating a collaborative care model, right, where we put counselors in the exam room with physicians, right?
She mentioned that. Yes,
Yeah.
that's great.
And that program is really growing opportunity and becomes, again, like we talked earlier, a grow our own and a pipeline to keep these mental health servants in our community.
That's fantastic.
So I work together a lot with them in this behavioral health center. And so we're partnering between Dr. Capel's intellectual property here, I guess, and her invention and idea with University of Texas Permian Basin, right, and then Texas Tech School of Medicine in our practice to help develop this collaborative model.
I love that.
So really,
that's going to improve
really
healthcare 100%.
Absolutely.
Absolutely. Okay, time for a question of the day, Dr. Benton. Throwing another surprise at you. Another one. So this is just...
I should have been more observant of these sitting on the desk.
Let's see which card you get here.
Unique.
Unique card. That very fitting, right? What is the question? Is it a good one? By your snicker, I'm saying it is.
How do you set goals? The process.
I love that. That's a good question for you.
That is a very good question.
Okay. How do you set goals?
That's a...
I'll be taking notes.
I'm trying to teach a lot of my staff how to do this, right? So I guess we talked earlier about these rituals in my life and my personal life, but in my work life, I use a journal that has me set goals quarterly. Okay, so I start with just sitting down, taking some time, reviewing the last quarter, reviewing what's gone on in my work, what's gone on in the people around me, doing, I guess, what I would call a needs assessment of what we need to move forward to next.
Is this personally? Is it professionally?
It's both, actually. Yeah, so put them together. So the first page of my journal is just write your goals, and it's just that, just 2 or 3 or 4 to accomplish in the next 3 months, in the next quarter. And then that particular journal has me go through breaking it down. So the next step is detail those goals. Okay, so it's just an idea, and then you sit and think and detail through them. And then I spread them out in my daily tasks. Okay. So
then you have your regular what to-do list, right? You sprinkle them in there?
Sure. Yeah. I try not to work too much from to-do list. I try to work more toward goal-oriented. You know, the to-do list are the things you have to do, and I try to keep up with some of those or delegate those. You're not telling my staff my secrets.
No, but one's listening over there going, yes.
But I try to set 3 items per day, small tasks toward my big goals.
All right.
Good
to know.
But the question really is, how do you set goals? And I think that's really just taking some time to reflect and look through what's happened in the past and where do we need to go.
I love that. Great advice. Thank you for sharing that. I appreciate that. Sure. We do a fun thing here called Favorite Things.
Well, and those were fun enough.
I know,
right?
Weren't these fun? It's going to get even more fun, Dr. Benton. So here we go. We're going to start with, before we do Favorite Things, a fun fact about you we would not know by reading your bio.
Fun fact about me. I love the outdoors. I don't get to do it anymore because I love West Texas now, but I love to fish. So I don't fish much anymore.
Well, hopefully you can travel somewhere where there's a lot of fishing.
And bird hunting. So I was a bird hunter. So outdoors things, and then I have horses at home. So we're in the horse world. Cowboy world, I guess. So maybe that's the thing you would know about me is at home I'm boots and jeans and cowboy hat.
Yeah, see, I would not have guessed that by looking, by looking at reading your bio. Thanks for sharing that fun fact. I just thought of one that I'm going to start asking all our guests. What's a fun fact about you your wife would say? Since you've been married 31 years. This will be fun.
Wow. So I would say she probably sees me reading a lot, and so she might at times say I'm a little boring. But
no, she would not say that.
No, she wouldn't say that. But
she'd say you're an avid reader.
I got a book for Valentine's Day.
So she knows your love language is books. Yes. Well, tell us out, since we're now moving into favorite things, what is your favorite book?
Oh my. I read a lot, honestly.
This is hard. This is a hard question for all of our avid
Yeah,
readers, I have found,
yeah.
to pick just one. Yeah.
It really is. And I guess one that I go back to a lot, which was really started my leadership journey. Someone handed me a copy of Develop the Leader Within You from John Maxwell.
Mm-hmm.
And when I started this particular role and this particular job, that was the #1 book club book that I did with my team. And I'm disappointed in him that he made a 2.0 version.
Have you read it?
Oh yeah, I've read 2.0 as well. But the first one was really neat about because it had subtitles to the chapters, to the titles in the chapters, and the oh gosh, I'm going to have to try to remember the quote, but it said it basically said leadership starts with you, right? Here's what the quote was. You like quotes?
I love quotes. I'm going to be writing this one down. Go ahead.
It said, change the leader, change the organization.
Yep.
And the whole chapter is about change yourself.
Love it. I love it. And that's where it starts.
Yeah.
It really does.
Right.
Yep. With those daily habits that you were talking about earlier.
Absolutely.
I love that. Favorite movie?
Well, this will tie to the unique thing that you didn't know about me.
Oh, good.
Open Range.
Okay. That is a
It's Robert Duvall, Kevin Costner.
Western?
Western.
Okay, that's what I was
Yeah.
thinking. I was thinking it was Western.
Yeah.
Fantastic. Favorite song? If we were going to play a hype song, you were going to walk into a room listening to the song that's going to make you just feel your best. What is your hype song?
Probably not going to hype, but it's probably going to be in the George Strait realm.
Okay.
Maybe This Is Where the Cowboy Rides Away or Amarillo by Morning.
Oh, yes.
And those I like that era.
Two great songs. Yeah,
Yeah.
I could see that being your hype song. If y'all ever have an award ceremony that he's emceeing, there you go. Play those too. She's taking notes. Favorite restaurant in West Texas?
Favorite restaurant in West Texas? I'm not supposed to do marketing, I don't think.
No, this is just
this is just me and you.
What if your go-to, because so many of us get in, and this is why I ask it. We all get in our bubble, right?
Yeah.
We have our bubble, and if I don't know what your bubble looks like, I may never go into your bubble and try that great restaurant.
So how far a range are you defining West Texas?
Well, West Texas is huge, so it can be anywhere.
Okay,
New Mexico.
I'm going to go back to the night I got engaged. My wife and I had Thai food.
Oh, okay.
So
I love that.
We like Thai food. I wish we could get a few more around here.
Yes.
Right? But there was a restaurant in Amarillo called Mai Tai.
Okay. What a cute
And-
name, too, for a Thai
yeah.
restaurant, Mai Tai. I
And
love that.
we still go back there whenever we get to go to Amarillo.
There you go. So next time you're in Amarillo, check
Mai
it
Tai.
out. Mai Tai. Thank you. Okay, favorite. Let me look at my my little list here. We already did a morning routine, which I loved. I loved your morning routine. That was great. Okay, favorite memory here in West Texas.
Favorite memory. Oh wow, there's a lot of them, and I think really, it's hard to not make that about my family.
And you can. That's what this is about. We would love to hear it.
Daughter, Nicole is my wife. Nicole and I have a daughter who's now a freshman at TCU, and I guess bringing her home was a favorite memory.
That's a good memory.
Right.
That's a good one.
Yeah.
You never forget that day, right?
Yeah.
You never do.
Yeah.
I love that. Favorite. I'm not going to ask you your favorite Taylor Swift song. Favorite.
Who's Taylor Swift?
No, there you go. Favorite podcast. That'll be our last favorite things question.
I can't say that.
You can't say your favorite podcast?
It's a 4-letter word.
Oh. I did not see that one coming. So you can use your imagination or Google.
It's really not. It's a leadership podcast
Okay.
from a guy out of Australia,
Uh-huh.
and it's no BS leadership.
Okay. You all know what it is now. We'll have to check it out.
That's not 4 letters, is it?
No, that's okay. We will have to check that out. That's great. We are getting close to the end of our podcast, but really quick, and this has been so much fun getting to know you better today, and I think our listeners, I'm sure, have enjoyed it as well. I want to ask you, because you are a doctor, and I don't always get to sit next to a doctor, I have to ask you a couple health questions really quick. Measles is a huge topic right now. So measles, what do we need to know? What do we not need to know? How do we differentiate, between what is important and what's not important that you hear in the news?
Yeah, so there is a little bit of resurgence of measles. Maybe resurgence is too big of a word, but we are seeing some cases again, right? And I'm old enough, as we've learned in this podcast, that I used to see a few cases of measles, right? The real key to it is it's preventable, right? And like I said, right over my 30 years, I saw it initially in my practice on occasion, even back then. But really, the young doctors that we're training now haven't ever seen it.
Right? I never thought of that.
It had pretty much been out of our society, right? There are still some places in third world country and things where it's occurring. So big thing is high fevers and rash. And it is a respiratory spread. So maybe it's kind of conjuring up memories of COVID for us. Although we don't see the severity of illness I think that COVID had at first. The people where it is severe illness, though, is in the really young.
Okay.
So in the kids and in the kiddos that haven't had immune system exposure through vaccination, it can cause a really significant pneumonia.
So if you have the high fever or rash, just go see your doctor right away.
Absolutely. Let us know.
Okay. Thank you. I appreciate you talking about that. You mentioned COVID. It seems like COVID we've seen more cases lately too. Are there any changes there we need to know about? Anything different than maybe the COVID of 2020 that, we're seeing this year?
No, I don't think so. Well, it's very different than 2020.
Yes.
It has become a much more of a common type virus, right? And not as, doesn't appear to be as deadly as it was before.
That's good news.
But we should still stay away from it, right? So take your precautions. It, sort of like I talked about with measles, still could be risky for the vulnerable, right? So extremes of age or people in immune compromise settings. But also, this honestly not much different than the flu, right? So, I mean, the flu is always deadly across the nation every year, but again, with the vulnerable. Right. So protect yourself.
Okay, good advice. Is there any other health tip you want to share with us today, since you have a microphone and can tell West Texas and beyond? Any number one health thing that you want people to know about?
Number one
that is really current and on your mind that you'd like people to know?
I don't have a particular current common disease,
okay.
That sort of thing. I'm a family doctor, and an ounce of prevention is worth a pound of cure. So I would say go after your prevention. As we talked earlier, lifestyle, right? But as you get my age, and I won't say your age or anybody else, but
I'm pretty close. I'm pretty close to you.
There's some screening things we need to be paying attention to, right? Whether it be breast cancer screening, colon cancer screening. So start thinking about prevention works.
I love that. That is great advice. Is there anything, Dr. Benton, that coming into today's podcast you hope that we got to talk about that maybe I haven't asked you besides a fun fact or your favorite things? Is there anything that you ought, you know what, I hope I get this out today about healthcare in West Texas?
Not particularly about that people could take away for their home life and their personal life. But I guess one thing that I would say is that sometimes it's overlooked that a medical school is potentially a real gem in a community. And I think sometimes we don't know in this community we have a medical school right here. So there's opportunity to do things, to innovate, and we've talked about collaboration with the community. and potentially to bring some experts to our community through a health sciences center and a school of medicine. So it's a gem. Don't overlook it.
I love that.
Yeah.
Well, thank you so much for your time. Thank you for choosing West Texas to share your gifts with. You do it beautifully. And this has been fun getting to know you better. So thank you so much. We want to thank all of you for listening. Please follow Texas Tech University Health Science Center, and please support your local doctors. And hey, tell your kids you can go to med school right here in West Texas. Let's keep them going. Let's keep them here, and let's keep practicing here in West Texas, because we need good people like you and your family to do so. Dr. Benton, thank you for your time.
Thank you.
We want to thank you and all our sponsors. So shout out to Rig ID, Omni Midland Hotel, the Laughlin Hotel, Midland Cap Company, and joincapclub.com. And don't forget my mottos: dream big, believe, and never give up. Thank you so much for joining us, and share this with someone you love. You make it a great day.